Government is in need of more money 5 months into the 2023-24 financial year. The supplementary, according to government, is meant to cover known expenses including wages and salaries, capitalizing the Performing Artists Circle, and 2.7 billion shillings for the supervision of Lubowa Hospital, among others. Economics specialist Dr. Fred Muhumuza and health analyst Alana Kembabazi think alike on the repercussions of such spending without a clear source of income.
You may want to pay medical interns, I've seen them in the supplementary, but is that all for me as a person who is seeking health care? Because to reach that health facility, now the roads are impassable. And quite often the conversation by Kampala people is the floods are in this place, so you have an alternative route. Now for villages, if that road is washed away, it is the only road to the next village or to the local town council where most of the services are.
Lubowa, there are no taxes. Government had to exempt tax, or at least make sure it doesn't cover any tax. Lubowa is increasing to our debt burden. No one is talking about that. Every time that work fails to deliver, that is money we are absorbing. At this point, the investor has played around and there are no penalties, and now you're shoving and even giving more money.
Dr. Muhumuza adds that the size and items of the supplementary defy the principles of budgeting and planning.
I find that part of this money is actually going to come from borrowing. And we had already limited the borrowing levels with intentions of not crowding out the private sector, raising the interest rates, but most importantly, managing future debt. Because you cannot borrow yourself out of debt. You've got to find every way to curtail your current pressure on borrowing.
On her part, Kembabazi says government should prioritize the spending in things that will benefit the ordinary folk. Otherwise, it will amount to abuse of the entire process.
From a perspective, this is the time we should really be actually looking very carefully and saying, what is it we need to spend on? And can we make sure we prioritize spending that is essential for the lives and needs of ordinary Ugandans? And everything else, you first pause.
In their defense, the spokesperson for the Ministry of Health, Emmanuel Aineviona, says the 2.7 billion shillings will pay contract engineers in various specialities.
These funds are to pay partly arrears for the engineers who are like a team of 8 with various specialties, civil works, electrical, architecture, to ensure that they undertake supervision on this project.
However, the government says the commitment to reduce the frequency and magnitude of unplanned supplementary expenditures is to cut debt servicing costs that consume up to 6 trillion shillings of the 2023-24 financial year budget. Walter Mwesigye, NTV.